understanding what constitutes a legal and complete prescription is not just restricted to pharmacy. You may not be able to read all of it and understand the technical language, but there are some basic elements that you should be able to identify. So for the next few minutes, we will identify a legally written prescription, describe the various components of that prescription, and compare the different types of prescription that exist. Now, let's look at the parts of the prescription. So you have this prescription here, and we will be discussing the various parts for the next few minutes. Now, the first thing that should be there is the prescriber's information and signature. So where does a prescriber practice? How do I contact this prescriber? And based on the jurisdiction that they're practicing in, what is this prescriber's license number? Now, the second thing that must be there is a patient information. So who is the medication for? I must see a name on that prescription. You want some details for the patient as well. So you can have things such as the date of birth of the patient or the age, the sex of the patient, whether the patient is male or female. You need to also have the address for the patient. And some prescription may also include what you call a medical record number, or a unique number that is able to identify or locate that patient's medical record. The third component that must be present in the prescription is a date, and this is very critical. Date here refers to the date that the prescription was written. In this case, it was written on the 21st of September 2023. The fourth component, this is the superscription. Now the superscription may also be referred to as the RX symbol. In essence, a prescription can be written on even a blank sheet of paper. Once this RX symbol is included on that blank piece of paper with all the other legal requirements, then it makes it a legally written prescription. Alright, so that is your superscription. Now, the other thing that must be included, of course, it's a prescription. So most persons are just familiar with the fact that you need to have the medications that are prescribed. So yes, the dosage form, in this case, item 1, you have a tablet. Item 2, you have an injection. And item 3, you have a suspension. So the dosage form of the medication that is prescribed, the name of the drug that is prescribed. So in item 1, I want furosemide. In item 2, I want insulin 70/30. And in item 3, I want Ulcogant. Now, all of this so the dosage form, the name of the drug, and the strength of the drug, all of that is called the inscription. Let's go on to number 6. This is a direction to the patient. So how should the medication be used? And this is what we call the signatura or transcription. So in the case of item number 1, the signatura here is 1 tablet by mouth 2 times daily. You look at item number 2, the signatura, 45 units in the morning before food. And for item number 3, the signatura, 10 mils 4 times daily. Now, another component that must be present are the dispensing instructions to the pharmacist. So the doctor writes the name of the drug, writes the instruction that must be given to the patient, and then there is also some instruction to the pharmacist as well. Now, what are these instructions? Now, these are your meeting. So, I want you to give 60 tablets to the patient, or I want you to give 20 mils to the patient, or give 500 ml of this suspension to the patient. That is the instruction to the pharmacist, and that is known as the subscription. And then any other additional information that the doctor might deem necessary for the prescription may be included here. So what do these information look like? It could be things such as repeats, or there is the generic law. In some countries, this is legally binding as well in terms of the practice of pharmacy. So this you might see also included on the prescription, where it allows for the doctor to indicate whether the patient will accept a generic substitution, or whether the pharmacist can go ahead and give a generic substitution for the brand that is prescribed on the prescription. Alright, so those are the various components that you will have on a prescription. Now, let us look at what the different types of prescriptions are. So there are mainly three types. You have your typical prescription, there is a medication order, and a compounding prescription. Now, what do these entail? Most persons will be familiar with your typical prescription order. And all those components, the 7 components that we discussed earlier, and of course any additional instruction, you will find those on your typical prescription. Alright, so all of that is needed to ensure that you have a legal document or a complete document. In terms of the prescription, it is a written or electronic document provided by a licensed healthcare provider, such as a doctor or a nurse practitioner or a veterinary surgeon or a dentist. Now, this authorizes a patient to obtain a specific medication from a pharmacy or dispensing facility for treatment. Now, when you look at the typical prescription, the patient will be handling. They can, of course, take that order to the pharmacy of their choice, or if it's an electronic order, then that order may be sent by the doctor to the pharmacist that the patient would like the order to be sent to. Now, in terms of your medication order, this is typically seen in a hospital setting. Now, what does this entail? It's a directive issued by a healthcare provider within a hospital or clinical setting to administer specific medications to a patient during their stay in that clinical setting. Medication orders are used to manage the treatment of patients within that hospital, ensuring that they receive right medication, right doses, as scheduled and as part of their care plan. So they are usually prepared by the healthcare professionals within the hospitals, such as the doctors or the nurses. Alright, so in this case, you will notice as well there are some additional details on this document that you may not necessarily see on the typical prescription, such as specific administration time for the medication. You may also see a little bit more detail as well for the patient in terms of patient specific information that you will not sometimes see on a typical prescription. So what are some of the drugs that you will sometimes see on these medication order? You might see something for pain that is administered intravenously, or an antibiotic for someone who has a severe infection that is going to be administered intravenously. Alright, now the third prescription that we will look at here is a compounding prescription. Now, this is a specialized type of prescription that involves the customized preparation of medications by a compounding pharmacist. These medications are tailored to meet the unique needs of the individual patients when you don't have commercial products, or the commercial products that are available are not necessarily suitable for the patient specific needs. So here, compounding the prescription becomes essential. You have to compound to give, say, specific dosage or specific dosage form, such as a liquid or a cream. The ingredients that are required, they may not necessarily be able to manufacture them or mass produce the specific product for to meet the patient's specific need, and in this case, of course, specialized compounding may be required for this particular patient. Compounding a medication prescription include things such as maybe like customized hormone therapy or individualized creams or pediatric suspensions, where you might have a dosage form that is available, say in a tablet. The child may not be able to take the tablet, so of course in that case you would have to compound that tablet into a suspension or a solution, whichever the case may be, to ensure that the child is able to get something that is safe and effective. Now that you have reviewed the parts of the prescription, feel free to visit this website for additional information on how to interpret prescription orders.